clinic. We opened up our health center 4 here to serve our population of over 200,000 in the Moore district. And we thank those who participated, who has enabled this clinic or this hospital, health center 4, to be on board. We open this for God and our country. Palabek Health Center 4 is a very important health center serving a population of over 240,000 people. We get even now visitors who come all the way from Guru side to come to this health center. And even from across the border, people come to get service here. And it is one of those health centers which is functioning well. We, under Dr. Deep and other partners, we have expanded the services, put in place the children's ward. The theater is in place where they can do operation. The health and the laboratories, the maternity ward has been there earlier, and so on. And we are working to see that we elevate it to meet the demand of that number of population. And I would like to thank the donors, the partners who have been with us, and also through our office of the Prime Minister, where we got money from the World Bank and Dr. Deep, which we have invested here to elevate the standard from Health Center 3 to Health Center 4. Our target now is to have in place facilities like cold room, where if somebody dies, the dead body can be kept. To improve on the theater, there is no ventilation, no proper air conditioning. We want air conditioning and improve on the sanitation around the hospital. I want the whole center here to have sanitation, waterborne sanitation, not pit latrines. These are just manufacturing jams. We don't want jams to be manufactured here. We want to make sure that we have all the water system here, waterborne toilets, and so on. Fortunately, the government has already supported our town council here with water system, which is coming to an elevated tank. We shall now expand that to cover the hospital. So we thank you people, the press, for coming. We are very far away from the center, from Kampala. Normally people forget us when we are this far. So, but I'm very grateful for our partners who have not forgotten us. They come to join hands with us to bring better health.
My name is Sachora Nancy Unonga, the Woman Member of Parliament for Lamu District. Today is a gracious occasion for us, the people of Lamu, particularly Palabek County, for having this health facility being commissioned as a health center 4.
Man. Kama kebe bari edano katu mapierta malit dongo lego ni kakan daktari kutike mabe we mon Palabek kicho wen ma koknyo bari ukat makum yon ana po ruba bilo na.
Yeah. Those are minor.
What kind of operation do you carry out?
Those are minor procedure like the dirty wounds, the wound which are not clean, we do it here. Wound which are clean, we do it in the major theater, major operation theater.
Anya,
the other side. The other side. Delivery, the other side. Yeah.
All abdominal operations.
The other side.
Okay.
Yeah.
Honorable Minister, a week ago we had that study camp in this particular.
I was following.
Thank you. And we had over 200 people successfully undertaken. And so far we have not received any report of wound sepsis or complications following the studies. This is a very big benefit. We had people coming from Amoro, Gulu, Rabo.
Coming here?
Yes.
What conditions were you in?
We had gynecological conditions, we had general surgeries, we had minor orthopedic cases, collection of cases, yeah, general cases.
I knew one who had a nephew of mine who was operated here.
You must be very happy now.
It has been a long-awaited function that the people has been yearning. And I must say that I am the happiest person among all the people who are gathered here. Because in 2022, on the 23rd of October, I brought the team from the Ministry of Health to come and do health facility assessment in regards to the upgrade of the facility. And I want to thank God that it has really come to pass. I want to thank the Ministry of Health, the Permanent Secretary, Dr. Diana Twine, the Minister of Health, Dr. Rosa Cheng, and all their staff who have really been very cooperative, our stakeholders, the development partners who are working in Palabek County and Lamour District, because Lamour District is one of the refugee hosting districts. And in a long, so many years, from the year 2018, when we hosted the refugee here, we didn't have any good health facilities in this zone that can really help, especially the mothers, the children, and all the adults. So having the Health Center 4 in Palabek, it is going to improve on the health service delivery for our people. And I want to thank our team that came 2 weeks ago to do the medical camp. So far now, this facility has done surgery of more than 200 people, and they were really successful surgery. We thank the ministry, we thank the Gulu Regional Referral Hospital, we thank UNFPA and all the development partners, IRC, just to mention them but a few. And also our district technical team, the health department, our DHO has been in the forefront, taking lead in coordinating all these programs, and it has really been at a success. And we know that the service that are going to be rendered here, it is going to reduce on issues of maternal death rates. Our people are not going to die, they used to die because of referrals. We are also grateful that we have a standby ambulance that is here at the station. Our workers are here. We also want to thank Kidum General Hospital through the help and funding from UNFPA. They've given us an officer who is going to be stationed here permanently to help issues of the operations together with our medical officers. We are very grateful and delighted. The wise men always say that when you're leading healthy people, you're leading wealthy people. We know that with this facility, there are so many good things that is coming because of it. But now I also want to call upon the Ministry of Health on issues of the staffing. We still have limited human resource here at the facility. I want to add my voice on behalf of my people that coming in the next quarter, at least there should be a special consideration under supplementary budget given to Ministry of Health so that we can get the targeted number of human resource to help, because the building is sufficient, everything that we need is sufficient, but now the human capital that we need so that they can do the needful is what we are lacking. Thank you very much, and we are very grateful.
Integrating climate smart practices in healthcare. Thank you so much.
Thank you. This project is a symbol of cooperation with Japan and Uganda and UNFPA. And the government of Japan is very interested in to highlight women, WPS and health. And this project is a concrete project of realizing such Japanese interest to encourage to utilize Ugandan women the situation to improve. Government of Japan is doing cooperation with not only Ugandan central government, but also the local government through, for example, GGP, grassroots project. It directly communicates with counterpart of Ugandan local authority or NGO to encourage the situation of local people's economical and health stations improvement. Thank you very much.
We are happy to be here in Lamo district, where we are opening we supported through funds from Japanese embassy and others, where we supported the operating theater, construction of the operating theater at this facility. You know, our mandate looks at three things. We don't want to see any woman dying from childbirth. We don't want anyone who needs family planning not having it, and those people who are abused, gender-based violence, we don't want to see. So we did an assessment last year, and we realized that there are some places they are so far. That's why we have our women dying. Because imagine this is 60+ kilometers from a facility where they can get cesarean section, they can get blood. So we are happy to be part of this. We want to support services that will be meaningful and they will save lives. This is saving lives. A woman who has complications, if you don't take care of them within the next 15 or 2 hours, you can lose them. We are looking at this to avoid so many maternal deaths or even complications that we have, which are costly in our context. And again, you're looking at this a community where there are so many refugees, people who have run away from their country. They tend to be marginalized, they tend to be left behind. For us, we want them to be part of the, to support government of Uganda, which has done a very good job of, accommodating the refugees, to make sure that they also have services and they are not left behind. Because if you don't give services to these refugees, even the indigenous will be affected, because they cohabit. Sometimes you don't know who is who. So it's good to give the services so that everybody can get the services. So as UNFPA, we are proud to be part of this team, so that we're able to provide the sexual reproductive health services, be it family planning, be it managing complications. So this is a very great occasion for us at UNFPA.
Yeah, in line with the current government guidance on refugee host community services, there is what we call total integration of refugee services into public or the host community services. Refugees and host communities are free to access their services from anywhere. Anyone from the host community is free to go and get services from the health centers situated within the sector. Similarly, refugees are free to walk out of the settlement and get services from facilities in the host community. This is what we mean by integration.
The policy of government is every county or constituency must have a health center for. Because for a place to be what we call a constituency, has that population which legislate health center for. But today I'm very happy. There are gaps. Gap in staffing, gap in funding, gaps in grant provisions. These are challenges which we now need to face and handle it to benefit our people. But other challenge which I want to see is still much here is health center for, because of the presence of refugees, it is still overwhelmed. The population is too large. If we need whatever services we shall be providing must be doubled in order to meet this number. Services has now been brought closer. Come and deliver at the facility. Don't stay with sickness at home, because here now you can walk in and test for any other sicknesses so that you know what is disturbing you. Avoid cell medication, because it is actually the hospital is now here. We have doctors, we have nurses, as far as capacity, all health workers are now available here. Come and attend to their services.
ka ada mo ko no ki siara ma bu ka no kon ki siara ma bu ke bum nyo patibe no tene bene pe no mi yen yo dan ne mo ko ki tin pin wa yom ki lwa ko wen ma ti kan pin wa yom ti twal men ne ro ne ti ma yaw no pe donc tin ti gan pin wa yom da ko fo minister ma me kwa me mi okuri meti enene kitam me mo no ti tunye wa chan ma tendo okelo lo wen kama le tunye wa bene yomi ye ki bana fo ko miti ma me gwa me aria yan po la kar wen gen men ngi ngoma pe ka do pushing tiara nyin we ro lo wen chung ka do mo chung ke ata mo lo kama ma pol pe ni ra tunye mere yoma ngi gen na nyam lo ye te tunye no yom cha wen no tunye yom apo be de wa ti ka ti ka na da ka ti ka bi ne center